So the question is, what is the difference between the three proteasome inhibitors, carfilzomib, bortezomib, and ixazomib? So they are different in their activity, let's say, in their mode of, they are somehow different in their mode of activity, and certainly in their tolerance spectrum. So Ninlaro is exceptional because it's extremely well tolerated, does not induce or cause neuropathy, has no or almost no cardiotoxicity, renal toxicity. So actually, when you use ixazomib in your patients, you are surprised about the excellent tolerance. Bortezomib is a very good drug. It's the first proteasome inhibitor, but has the risk of neuropathy and has a very strong T-cell suppressive activity. You have to be careful. You see more herpes zoster reactions with bortezomib than I saw with Ninlaro. And carfilzomib is an excellent drug, of course, very active, but has its side effects, particularly in elderly patients. So, and Ninlaro works very well in young and in elderly patients, in patients with and without high-risk cytogenetic factors.
Yeah, ixazomib is different to the other proteasome inhibitors. It's a boronic type proteasome inhibitor, and bortezomib is also a boronic type proteasome inhibitor. However, carfilzomib is the second generation proteasome inhibitor, is an epoxy ketone proteasome inhibitor. The mechanism of action is different, and although the three proteasome inhibitors targeted the proteasome, the exact mechanism of action is not exactly the same. In terms of activity, I think that it's not easy to compare the three proteasome inhibitors, mainly because they have not been so far compared in a phase 3 randomized trial. I would say that the proteasome inhibition is a key mechanism of action relevant for the treatment of all patients with multiple myeloma. What is important is that bortezomib was the first proteasome inhibitor used in the clinic, and the second generation proteasome inhibitors, carfilzomib and ixazomib, are effective in patients previously treated and even in patients refractory to the first generation proteasome inhibitor. I would say that the three proteasome inhibitors we have now in our clinic are complementary more than a strategy alternatives, and I think that we can use probably the three proteasome inhibitors across along the course of the disease of one specific myeloma patient.